Welcome to another deep dive. Today, we're going to be tackling nutrition support.
Oh, very interesting.
So what happens when someone can't eat enough on their own? We're talking enteral and parenteral nutrition.
Right.
Two methods that can be an absolute lifesavers for patients.
It's fascinating, isn't it? We're essentially taking over the job of the digestive system
Yeah.
to make sure the body gets the fuel it needs.
Okay, so for our nursing students and faculty tuning in, can you give us a quick rundown of what these two methods actually are?
Absolutely. Enteral nutrition, or EN, is all about using the gastrointestinal tract. So think feeding tubes delivering nutrients
Okay,
directly into the stomach or small intestine.
right.
Parenteral nutrition, or PN, is our backup when the gut isn't an option.
Okay.
We go straight to the bloodstream with this one, delivering nutrients intravenously.
And the materials you sent really hammered home that EN is the preferred route whenever possible.
Yes.
What makes it the gold standard?
It's all about mimicking the natural process as closely as we can. EN is generally safer, it has fewer complications, and it's easier on the wallet compared to PN.
Right.
Plus, keeping the gut active is important for overall health.
It's like a use it or lose it.
Right, exactly. And speaking of using it, one of the sources actually walks us through a case study
Oh, interesting.
about a 21-year-old skier named Sandy. Multiple fractures after a nasty fall meant she couldn't eat normally.
Oh, wow.
So EN was the way to go.
I was particularly interested in how they calculated Sandy's specific needs.
Right.
They broke down her calorie and protein requirements based on her weight
Yeah.
and even factor in her BMI.
Right, and that's a crucial step. Every patient is unique, so we can't just use a one-size-fits-all approach. Determining the right amount of calories and protein is essential for healing and recovery.
If you were the nurse caring for Sandy, what would be top of mind in terms of making sure she's actually getting the nutrition she needs?
Well, first and foremost, we need to be vigilant about monitoring her intake. Is she getting the prescribed amount of formula?
Right.
Are there any sign of intolerance? Diarrhea, nausea, or vomiting could indicate that we need to adjust the plan.
Makes sense. And speaking of the formula, the materials we have really highlight the sheer variety available. It's not just a matter of picking any old can off the shelf, is it?
Not at all. We have standard formulas
Okay.
made from whole food sources, perfect for folks with normal digestion.
Right.
But for patients with absorption issues, like those with Crohn's disease, we might opt for hydrolyzed formulas that are already pre-digested. And that's just the beginning. There are high-protein, high-calorie, fiber-enriched formulas, even specialized blends for specific diseases.
It's a bit mind-boggling, honestly. And then on top of the formula itself, there are different ways to actually deliver it.
You got it. Intermittent feedings mimic regular meal patterns.
Okay.
Continuous drip provides a slow and steady flow of nutrients. And then there's bolus feeding, which is a quicker delivery,
Okay.
but can sometimes be harder for patients to tolerate.
So with Sandy and her fractures, do you think one delivery method might be more suitable than others?
That's a great question. For someone in Sandy's situation, especially with her being hospitalized, continuous drip eatings might be the most comfortable and manageable option.
Makes sense. But let's be real, BN isn't always a walk in the park.
Right.
What are some of the challenges nurses need to be prepared for?
Oh, there are definitely hurdles. Tubes can get clogged or displaced, which can be frustrating for everyone involved.
Right.
Some patients experience anxiety about the whole process,
Okay.
and others develop intolerance symptoms like nausea or diarrhea.
So it sounds like being able to recognize and troubleshoot these problems is crucial for nurses.
Absolutely. We need to be eagle-eyed, monitoring things like weight, intake, and output, lab values, and of course those GI symptoms we talked about.
Right.
Early detection can prevent minor issues from becoming major setbacks.
One thing that really struck me in the materials was the point about diarrhea. It's not always the formula itself causing the problem, is it?
That's a fantastic observation. Often it's actually medications causing the GI upset, not the EN formula.
That's a great reminder to look at the whole picture. And then there's aspiration, which is probably one of the scariest complications, especially when the tube is in the stomach.
Aspiration is definitely a serious concern.
Yeah.
But luckily, there are ways to minimize the risk. Keeping the head of the bed elevated and verifying tube placement before each feeding are simple but effective strategies.
I'm starting to realize just how much responsibility falls on nurses' shoulders
Right.
when it comes to managing EN safely.
It's a lot, but nurses are incredibly skilled and adaptable.
Another area that caught my attention was the whole issue of giving medications through the feeding tube. Had no idea it was so complicated.
It can be tricky. You can't just mix meds with the formula because that can cause all sorts of problems,
Oh, really?
from rendering the medication ineffective to clogging the tube completely.
So what's the workaround?
It's all about a careful process. Stop the feeding, flush the tube with water, give the medication, and then flush again.
Okay.
These steps ensure the medication gets delivered properly without any unwanted side effects.
And here's a tidbit I found surprising. Liquid medications, which seem like they'd be easy to administer through a tube, often contain sugar alcohols that can actually contribute to diarrhea.
It's true. It's one of those things that you wouldn't necessarily think about until you really dig into the details.
Okay, so we've talked a lot about the ins and outs of EN, but the ultimate goal is to get people back to eating normally, right?
Exactly. We want to help patients regain their independence and enjoy food again.
So how do we go about transitioning someone from EN back to a regular diet?
It's a gradual process. We start by stopping the feedings before mealtimes to encourage appetite.
Okay.
Then we slowly increase oral intake while closely monitoring how the patient tolerates it.
So in Sandy's case, as she heals from her fractures, you'd be working with her to gradually reintroduce food and eventually wean her off the feeding tube altogether.
Precisely. It's about supporting the body's natural ability to heal and adapt.
This brings us to parenteral nutrition, which, as you mentioned, comes into play when the GI tract is out of commission. What are some scenarios where PN becomes necessary?
PN is a lifeline in cases of severe malabsorption, bowel obstruction, or when the bowel needs time to heal and rest. Sometimes a patient's nutritional needs simply can't be met through EN or oral intake alone, and that's when PN steps in.
But our sources are very clear that PN is a last resort. Why is that?
It's more expensive and carries more risks than EN. Remember, we're bypassing the body's natural digestive processes with PN, which can lead to complications.
That makes a lot of sense. And just like with EN, there are different types of PN, right?
Yes, we have peripheral PN or PPN, where nutrients go into a smaller peripheral vein, and then there's central PN, which involves delivering nutrients into a larger central vein.
Why would you choose one over the other?
Central PN is generally preferred because it allows us to deliver a more concentrated solution. It's like taking the express lane versus the scenic route. We can get those nutrients to the body more efficiently.
I see. So what exactly goes into these PN solutions?
It's a carefully balanced cocktail. We have protein, carbohydrates in the form of dextrose and fats delivered as intravenous lipid emulsions or IVLs. Think of them as tiny packages of fat that the body can easily absorb.
That's fascinating. And I'm guessing it's not just those macronutrients. What else is in there?
We also need to include electrolytes, vitamins, and trace minerals. It's like a multivitamin on steroids, providing everything the body needs to function when it can't get those nutrients through food.
It's like a lifeline in a bag, delivering everything the body needs.
Exactly. But this brings us to a crucial point, the need for meticulous monitoring and aseptic technique when administering PN.
Why is that so important? What could go wrong?
Well, one major concern is infection. Because we're going directly into the bloodstream, there's always a risk of introducing bacteria. That's why sterile technique is absolutely paramount.
That makes sense. Are there any other risks associated with PN that we should be aware of?
Definitely. One serious complication that comes to mind is refeeding syndrome. It can happen when we start PN too quickly in someone who's been severely malnourished.
That sounds scary. Can you break it down for us?
Yeah.
What causes refeeding syndrome and what are the potential consequences?
Absolutely. In a nutshell, when a malnourished person suddenly receives a surge of nutrients, their body can go haywire. The rapid influx of glucose can trigger dramatic shifts in electrolytes, potentially leading to serious problems like heart failure.
That sounds like something nurses need to be hyper aware of. How can we prevent refeeding syndrome from happening in the first place?
The key is to start PN slowly and gradually increase the rate as the patient adjusts. We also need to be incredibly vigilant about monitoring electrolytes and providing supplemental thiamine, which plays a crucial role in glucose metabolism.
Okay, so we've got these potential complications to watch out for, but assuming everything goes smoothly, what's the end game with PN?
Just like with EN, the goal is to wean the patient off PN as soon as they're able to tolerate other forms of nutrition, either enteral or oral.
How does that transition work?
It's all about gradually decreasing the amount of PN while simultaneously increasing oral or enteral intake. It's a balancing act that requires constant monitoring and adjustments based on the patient's response.
So much of this comes down to careful observation and individualized care, doesn't it?
Absolutely. Each patient's journey is unique, and that's something we need to be mindful of throughout the entire process.
We've covered a lot of ground here, from the basics of EN and PN to some of the trickier aspects of managing these therapies. Do you want to summarize some of the key takeaways for our listeners?
Of course. I think the biggest takeaway is that EN is always our first choice if the gut is working. PN is our backup, but it comes with its own set of challenges and risks.
And with both methods, careful monitoring and individualized care are absolutely paramount.
Couldn't have said it better myself.
Welcome back to our deep dive into nutrition support. We've been unpacking the differences between enteral and parenteral nutrition, and honestly, it's like opening a whole new dimension of nursing care.
It really is, and the more we delve into it, the more I'm struck by how much there's to learn and consider.
Earlier we were discussing how crucial it is to calculate a patient's individual calorie and protein needs for EM. I think it would be really helpful to break down that process a little further for our listeners.
Absolutely. It's one of those fundamental skills that every nurse involved in nutrition support should have down pat. So let's imagine we have a patient who weighs 75 kilograms. The textbook we're working from suggests using 25 to 30 calories per kilogram of body weight per day as a starting point for estimating their calorie needs.
Okay, so for our hypothetical 75-kilogram patient, that would mean somewhere between 1875 and 2250 calories each day.
Precisely. And when it comes to protein, the general recommendation is about 0.8 grams per kilogram of body weight. But remember, that number can go up significantly for patients who are older or dealing with illness or injury. We might be looking at 1.2 to 2 grams per kilogram per day in those cases.
So for our 75-kilogram patient, that's at least 60 grams of protein daily, but potentially much more depending on their specific situation.
Exactly. And it's important to remember that these calculations are just the beginning. The patient's underlying medical condition, their activity level, even their metabolism, all of these factors played a role in determining their true nutritional needs.
It really highlights the importance of individualized care, doesn't it?
Absolutely. And this is where our amazing registered dietitians come in. They are the true experts in assessing those specific needs and creating personalized nutrition plans.
They're such valuable members of the healthcare team.
Couldn't agree more.
Now, the textbook also touched on the different types of feeding tubes used in EN. It seems like the choice depends largely on how long the patient will need nutritional support.
That's right. For shorter-term needs, we often use transnasal routes. These tubes go through the nose and into either the stomach or small intestine.
And for patients who require EN long-term, we might consider an ostomy route. That's where a surgical opening is created to deliver nutrition directly into the stomach or intestine.
You got it. And as you can imagine, each route has its own pros and cons. The decision really hinges on the individual patient's circumstances and what's going to be most beneficial for them in the long run.
This brings us back to the all-important topic of monitoring and managing complications. We talked about some of the common challenges with EN in the first part, but I want to circle back to refeeding syndrome. That whole discussion really struck a nerve with me.
It's a critical topic, and it's something that every healthcare provider needs to have on their radar. As we discussed earlier, refeeding syndrome can occur when nutrition is reintroduced too quickly after a period of starvation or severe malnutrition.
And the consequences can be dire if it's not caught and treated promptly, right?
Absolutely, it can be life-threatening. That's why close monitoring for any red flags is so crucial.
What are some of the signs and symptoms that would raise a red flag for nurses?
Rapid weight gain is a big one. We also need to be on the lookout for fluid retention, electrolyte imbalances, and any changes in mental status.
So basically, if a patient starts exhibiting any of those symptoms, it's time to sound the alarm and get the healthcare team involved immediately.
Exactly. Early detection and intervention are key to preventing serious complications from refeeding syndrome.
The source material also delved into the psychological impact of EN and PN, which I thought was really insightful. It's a reminder that we're not just dealing with physical needs here, but also with a person's emotional well-being.
I couldn't agree more. Imagine how you might feel if you suddenly couldn't eat normally and had to rely on a feeding tube or intravenous nutrition. It would be a huge adjustment.
A lot to process, both physically and emotionally.
Absolutely. Patients facing this situation might experience a whole range of emotions: anxiety, fear, frustration, maybe even a sense of loss or grief. It's a lot to cope with.
So as nurses, how can we provide that emotional support to patients navigating these complex feelings?
First and foremost, it's about being a good listener. We need to create a safe space where patients feel comfortable sharing their concerns and anxieties, validating their feelings, letting them know that what they're experiencing is normal. That's huge.
Just feeling heard and understood can make a world of difference.
It really can. And then it's about providing clear and honest information. Explain the procedures, what they can expect, and answer their questions in a way that's easy to understand.
Knowledge is power, right? The more informed a patient feels, the more control they have over their situation.
Exactly. And sometimes the most powerful thing we can do is simply be present. Offer a compassionate ear, a warm touch, a moment of connection. It's those small acts of kindness that can make a huge impact on a patient's emotional well-being.
It's all part of that holistic approach to care that nurses are so incredibly good at.
Couldn't agree more. And remember, it's not just the patient who needs our support. Their families are going through this journey alongside them, and they might be feeling overwhelmed and scared as well.
That's such a great point. Family support is crucial.
Absolutely. Involving families in the care process, providing them with education and resources, answering their questions, all of these things can go a long way in easing their anxieties and helping them feel more empowered.
It takes a village, right?
Exactly. It's a true team effort to provide comprehensive care that addresses the physical, emotional, and social needs of both the patient and their loved ones.
Well said. We've covered a lot of ground today, from the nitty-gritty of calculating nutritional needs and choosing feeding tubes to the more sensitive aspects of providing emotional support to patients and their families.
It's been a really rich discussion, and I'm so glad we had the chance to dive into these nuances.
I agree. And even with all this information, I feel like we're just scratching the surface of this vast and complex topic.
There's always more to learn, isn't there?
Absolutely, but I do think our listeners are walking away with a much deeper understanding of nutrition support and the vital role that nurses play in ensuring its safe and effective delivery.
I hope so. It's such a rewarding area of nursing. I'm always excited to share my passion for it with others.
I could definitely feel that passion. So as we wrap up this part of our deep dive, what are some key takeaways you'd like to leave our listeners with?
Well, I think the most important takeaway is that both EN and PN are powerful tools in our arsenal. They have the potential to make a real difference in patients' lives, helping them heal, recover, and regain their strength.
But as with any powerful tool, it's essential to use them wisely and with a deep understanding of both their benefits and their risks.
Exactly. And that means staying informed about best practices, mastering those essential skills like calculating nutritional needs and managing complications, and always putting the patient at the center of everything we do.
And never underestimating the power of a compassionate heart and a listening ear.
Couldn't agree more. Those qualities are just as important as any technical skill when it comes to providing truly holistic care.
Welcome back to the Deep Dive. It's amazing how much ground we've covered already, but I feel like we've only just scratched the surface of nutrition support.
There's always more to uncover, isn't there?
Absolutely. In the previous parts, we really focus on the hospital setting, but I'm curious about how nutrition support plays out in other areas of healthcare. What about long-term care facilities, rehab centers, or even home settings?
That's a great question. The core principles remain the same, but the practical considerations can be vastly different. Imagine the challenges of managing a feeding tube or administering PN in a home setting.
That brings a whole new layer of complexity, doesn't it?
For sure. Patient education and a family involvement become even more crucial. You're essentially training someone to take on responsibilities that are typically handled by nurses in a hospital.
It highlights the need for really comprehensive discharge planning and ongoing support for those patients and their families.
Couldn't agree more. We can't just hand them a bag of supplies and wish them luck. It's about empowering them with the knowledge and confidence to manage this aspect of their care safely and effectively.
And speaking of empowering, I'm also curious about the role of research and innovation in the field of nutrition support. What are some of the exciting developments happening right now?
Oh, there's so much happening. Researchers are constantly looking for ways to improve patient outcomes and quality of life. New formulas, delivery methods, monitoring techniques. It's a really dynamic field.
Can you give us some specific examples? What's piquing your interest these days?
Well, one area that's really fascinating is the use of probiotics and prebiotics in both EN and PN. We're learning more and more about how important gut health is for overall well-being, and these supplements can play a role in supporting that.
So it's not just about delivering nutrients anymore. We're also thinking about how to optimize the gut environment for better absorption and overall health.
Exactly. And then there's the whole concept of personalized nutrition. Imagine tailoring formulas to meet the specific needs of each patient based on their genetic makeup or metabolic profile. That's where the future is headed.
Wow, that's incredible. It sounds like the future of nutrition support is very bright.
It truly is. And as healthcare professionals, we have a responsibility to stay informed about these advancements and incorporate them into our practice. We need to keep learning and growing so we can provide the best possible care for our patients.
I couldn't agree more. It's all about embracing that spirit of lifelong learning.
Absolutely.
Well, this deep dive has been an incredible journey for me. We've explored the fundamentals of EN and PN, delved into the challenges and triumphs of managing these therapies, and even caught a glimpse of what the future holds.
I've enjoyed our conversation immensely. It's been a wonderful opportunity to share my passion for nutrition support and hopefully spark some curiosity in our listeners.
I have no doubt you've done just that. But before we wrap up, I want to circle back to something you said earlier. You mentioned that nutrition support is about so much more than just delivering nutrients. Can you elaborate on that? What's the bigger picture here?
You're right. It's about so much more. It's about nourishing the whole person's body, mind, and spirit. It's about helping patients regain their strength and independence so they can return to a life filled with meaning and joy.
That's beautifully said. It's a reminder that even in the midst of illness and complex medical interventions, there's always room for compassion, empathy, and that human connection.
Couldn't have said it better myself.
Well, on that note, I think it's time for us to surface from this deep dive.
I agree. It's been a wonderful exploration.
A huge thank you to our listeners for joining us on this journey. We encourage you to continue exploring the fascinating world of nutrition support. There's so much to discover, and who knows, maybe you'll even be inspired to specialize in this rewarding field.
Until next time, 1690i.